All right, there we go. Looks like we're ready. All right, here we go in 3, 2, 1. What's up, y'all? Welcome to the Sports Medicine Broadcast, a podcast to promote and improve your practice as an athletic trainer. I've been working on the patient-reported outcomes, patient-centered approach to athletic training services. And one of the things that I've really struggled with is goal setting. And so we're going to have some kind of working definition of what we're talking about. But Daria, Ray, and John are going to help me figure out how I can help my patients set their own goals, help them set some goals that they can achieve, some goals that are going to stretch them, and do it in a way that they understand and they don't just stare at me awkwardly. So, without much further ado, I want to introduce Ray, John, and Daria. And if you've been listening or watching for a while, you've seen all of them at some point before. So, Ray, you're first up on the screen. Why don't you give a quick good morning?
Morning, y'all. How you doing?
And then John next.
Good morning, everybody, from sunny Michigan.
As he was shoveling snow in his shorts this morning. And then Daria.
We'll say good morning from not so sunny New York City.
This is sportsmedicinebroadcast.com/goal setting in rehab. Sportsmedicinebroadcast.com/goal setting in rehab. So without much further ado, Daria, as a physical therapist and a licensed athletic trainer, you were just talking about how you set goals every day for patients. And so I want to get a working definition so that we're kind of on the same page. We're making sure we're talking about the same thing as far as goal setting. So what do you have for us?
Okay, yes. So with all of my clinic patients, we set goals. And what we're doing is you're taking so the patients will have something that they may not be what we're thinking. Particularly as athletic trainers, we might just be thinking about they want to play their sport again, but there might be other things, middle steps that have to get there, things not related to sports that they want to do. So taking something that's important to them that they want to achieve, and then on our end, looking at objective things that they need to meet. And that could be range of motion, strength, balance, looking at our outcome assessments. And then so from what we're looking at objectively, what do they need to do to be able to get to whatever their ultimate goal is? So you want to look at goals that they are measurable and attainable, that they are time oriented. We're always making sure that there is a time parameter on the goal, that is just not open ended, and that we're working on them together. It's not me as a clinician saying this is what you're going to be able to do later. Listening to them as a patient, we talk about patient value a lot, making sure that we are hearing them and recognizing them as the total person.
All right.
Yeah, I'll kind of add to that. I'm sorry, Jeremy.
Go ahead.
I'm cutting you off. Yeah. I was gonna. Sorry, it was a weird transition there, but I was gonna kind of add to what Daria just mentioned. I kind of use those SMART goals as a base, if you will, for goal setting. But again, to echo what Daria had said, I think it's twofold when you start thinking about patient-centered goals. So number one, you want to treat you have to use the ailment, if you will. So whether it's an ACL or ankle sprain or rotator cuff strain, as a guide in a sense, but you're treating the patient first and foremost. So you got to see what their goals are, not only athletically, but again, like Daria had mentioned, what do they do on an everyday basis with their activities of daily living? So does it hurt when you get up and down the stairs? Does it hurt when you're transitioning from a seated position to a standing position, et cetera? I mean, those are the little things that are going to help aid us when we do get to the more functional athletic side of things, because those simple movements and elementary steps that they take in their everyday lives are really going to enforce a little bit of confidence in them as they transition to their athletic side of things here.
All right, let's go back to the objective measures. That was the first thing that Daria gave us, is looking at objective measures. And so one of the things that I've been asking to kind of measure is a subjective. It's what is your pain 0 to 10? I think that's subjective, right? Yeah? So, what? How can I change that? Because let's define objective a little bit more. I think you said this degree of flexion or that kind of thing. But even looking at stuff like if you're using the Compex or using biofeedback units, those kind of things, those are subjective to where you place the pads as well and subjective to the day. And so let's talk a little bit more about objective measures and so that we're a little bit more clear. All right. Daria, you want to lead us there?
Yes, yeah. So with objective measures, it could be as like simple or as basic as looking at getting out a goniometer, looking at range of motion, getting some strength parameters, and it could be through a manual muscle test, which are somewhat subjective, but you could use MMTs. Looking at, can they say a particular lift? Can they move this much weight when they're doing a squat, for example? Things that they will need to be able to do to ultimately get to that goal. Because say somebody just generally has, make this bad, like 2 ad with 3 strength in their leg, they're probably not going to be able to run because you need a lot more strength than that to run. So, and you can even take a baby steps. Like if it's somebody who's post-op, you might not be setting a big goal of running yet because that's going to be so far away. So taking something, they need to be able to walk. What do we need functionally? We need this much range of motion at each joint. We need so much strength. And you can include subjective too. Pain is important because sometimes I'll set goals related to that pain will go from moderate to minimal, whatever scale you're using, to allow them to sleep better. So they're not getting awakened as much at night with sleep. So they're able to sit for an hour before being disturbed by pain, things like that. So you can use, even though it's subjective for the patient, you still can use pain as one of the measures you're using, because you don't want to just kind of say, not that anyone would do this, but the patient will be better. Like, what does that mean? So what are ways we can actually look at on paper to kind of say, okay, they were here, maybe put some numbers on it, and now they're over here, which on my end in the clinic, we need for insurance purposes. And either way, we still want to show that what we're doing is helping, is effective. Or you can look at it and say, well, here, objectively, you were only able to walk, say, 50 feet, and 2 weeks later, you still can only walk 50 feet. So what do we need to change? Or what do we need to improve so you can get closer to your goal?
All right. So I think that does a pretty good job of giving us some working definitions, and we'll go through kind of as we talk through some of my examples of what we're looking for. And again, objective measures, as we just talked about, the range of motion, the strength parameters, the rep or weight count, the distance, if it's, how far can they walk without getting tired, that kind of thing. And then don't use words like the patient will feel better, because that there's no measurable part there. Using the SMART concept, which is the specific, measurable, attainable, realistic, time bound. So working on them together and then recognizing them as the total person. And again, that's kind of one of the big reasons that I'm trying to move towards the patient reported outcome measures, which Ray was with me on that one, and moving towards the patient-centered athletic training services, because their goal is not always my goal. So I think in athletics for so long, we've assumed that the goal was to get back out there and play, just to get back out there and play as fast as they can. Well, as I've learned through the podcast, sometimes their goal is to take a day off. One of the kids that I checked out just yesterday said, hey man, where's your battery today? Are you 100% full? You like at 0%? He's like, man, my ankle was hurting. I didn't sleep at all. I feel like I'm about 10%. Like I'm just drained. And so then it's like, well, yes, his ankle is swollen, but his goal is also to reduce the pain so he can sleep, not so he can get back out there, but his immediate goal is to reduce that pain so he can sleep, so he can recharge his battery and be ready to train, do the rehab stuff the next day or the next day. So it's important to figure out how you're going to work these into your system of what you're doing, and then just kind of continue to grow with it there. So John, let's go with some examples of not good goal setting. Maybe some times where you tried and didn't work or things like that, and then we'll just kind of go down the line. So again, we're looking at not good goal setting. I mentioned before where I've said, what's your goal for today? And they're like, I don't know, for you to check me out, for you to say I'm good. So what are some examples you have, John?
We're talking about patient-centered care right here. And when we look at that and look at bad goal setting, if you take the patient out of the equation and start setting goals as the practitioner, number one, that shows your ego as a practitioner. All right. So if you come in and you're like, hey, listen, this kid, I want them playing at week 2 versus week, 10. And that's pushing your ego onto the whole subject. So if you take the patient out of this, that is what's going to set you up for failure for goal setting. And that, to me, that's not even goal setting. That's just pushing an athlete. And yeah, in athletics, there are plenty of times where we have to push an athlete, but we have to do it smart, right? We have to do it where we're not going to injure the athlete any further. We're going to, take time away from them. We have to be continuously listening and building a rapport with the athlete, with the patient, so that it comes back to the patient and we're understanding what their goals are. If you take the patient out of it, that's where you're going to fail when it comes to goal setting. So.
Yeah, and I'll kind of add to that, John. So I 100% agree. I think a big failure in goal setting is absolutely removing the patient. I think in the athletic training setting, having other extrinsic factors navigate your goals are also a big problem. So for example, having coaches dictate when an athlete should return to play is a major flaw in athletics, especially in our field of athletic training. So again, just kind of getting back to, I don't care what you say as a coach, or I don't care what the parent says. I don't care what we're gonna do what's the best thing for our patient at the time.
And there's plenty of times too where somebody gets injured, and I've done this, and I still continue to do this. And I, luckily, the more I work, the more I practice, the more I catch myself. But it's, hey, so and so got a concussion on Friday. That means they're back the next Friday, right? And you start agreeing with them. Or they sprain their ankle. That means they're out for a week, right? Or they're out for 2 weeks. And you're like, well, yeah, in your mind, you want to say, yeah, 2 weeks is fine, perfect. But then what you end up doing is taking the patient, you take the athlete, you take the student out of that equation, and you don't actually work with them. So you automatically set a goal, which may not be attainable at all. And then you're pushing yourself up against time frame, which then pushes your ego, pushes you as a practitioner to try to get this patient back in an unhealthy way.
I'm going to give a personal real life example of awful goal setting. So for anyone who's on Twitter, I've been talking about having long COVID. I've had symptoms since March. So because I'm a very stubborn athlete, initially I'm just I want to get back to running and walking and dancing and things. So when we only are looking at sport participation, I still was able to say, I can walk so far, I can run so far. But if you look at the whole picture, I was completely crashing every time. Like my symptoms were getting worse, things were not good. But I was able to go participate in the sports and dance that I want to do. So making sure when you're also setting those goals, it's not just like, can they get to the game or the practice, but what is it doing to them? What is the quality of their participation? How is it affecting the injury or illness that they have?
All right. So, like I said, I've had plenty of examples where it's the same thing. Like, all right, well, 2 weeks. Even yesterday with a kid with the ankle, I was like, so, with the amount of swelling, I would expect that you might be back out there practicing in 2 weeks. I didn't say, hey, coach, he's going to be back in 2 weeks playing. I said, I would expect you be back in 2 weeks, so that he kind of has an idea and a time frame, right? And so, working in all of these things. Let's look at some examples of how we can do that. Because like John said, yeah, he'll be back in a week. But how can we work in, it is specific, it's measurable, attainable, realistic, time bound, or whatever, little change in that formula that you're using. So we got this kid sprained his ankle on Sunday. It's, a lot of swelling, limited range of motion. But how do I help him set those goals so that he can succeed, so that I can motivate him but not push him beyond where he's capable of? What are some of the things that you might do, questions you might ask, things you might measure as we're going through there?
Yeah, so I think for me, and Jeremy, I've kind of touched on this before in the past, is just kind of walking the patient through the process. So, just educating them on well, hey, you got this, swollen ankle, your range of motion is very limited, you've got, X amount of pain. Let's work on getting this inflammation down here. Let's work on decreasing your pain. Let's work on getting better range of motion, and not setting a timeline necessarily on creating those things. And then you say, hey, once we decrease this range of motion, increase this range of motion, decrease this inflammation, etc., we can start getting into more functional stuff. We can start working on some strength exercises, some functional movements. Then we can get into plyometrics. We can get into sport-specific exercises. Again, just in a broad scope of things, just really educating the patient on what you expect out of them, and then offering them to give their expectations of you as a clinician as well.
I like to take a look at it from a department view of dealing with injuries. So, last year, what we ended up doing as a department was we set department goals. What is our goal as an athletic training department here in the high school? Once we took that, then we created our personal goals as practitioners. So I do it with the interns. I did it with my assistant, myself. What were our professional goals for that year? Didn't have to be 10 or 20 of them. It was 2 or 3. And then when we put them, we literally wrote them and put them on the wall. That led everything that we did last year. Of course, we didn't get a chance really to do it this year because everything got blown up in the spring, but we looked at that every single day in our office. And every single time we had we started dealing with a patient, we started dealing with an athlete, or we could feel ourselves kind of slipping with an athlete, like things aren't progressing, things aren't doing well. We had to look back at that set of goals as a department, as the individual. So when we look at, for me, when I look at patient-centered goals, and I know I just talked about the ego of the practitioner, you still need to have a goal as a practitioner to help guide you with your own patient care. And that for us really, really helped us last year. It increased our patient contact. So, the students started seeing more. They started trusting us more. Other students that we may not have seen in the past, they started to come to see us more. We gained trust with our coaching staff, with our administration. And we really started getting more busy than we had in the past. Once we created that initial goal, that led us to dealing with the patient and then asking them, what are your goals? When their goals aligned with our goals as a department, that's when we saw those patients accelerate through their rehabs.
That's fantastic. I love that. I think it's so easy in any setting to just go in and do your work and go home, and we get in ruts, and especially when you have athletes who just, through their faults or not, if they just want to do modalities and stuff, we just kind of get in the cycle. So when you have a thing you actually are looking towards and working towards, and what is my purpose? Why am I personally here every day? That allows you to better help people. For me, it's different, I think, in a clinic setting, but I'll go home and have to write up my evals, and I look at, I'm literally putting everything together, looking at the big picture. All right, they want to get to here, and we're currently here, and what are all the little things in between that have to happen? Because it's when working with, regardless of what the injury or illness is, athletes can become frustrated because they're not at their end goal yet. I literally just had this conversation last night with somebody. One of the big goals is he wants to be able to just bend forward and tie his shoes again, and there's things limiting it. And I said, even though you're not there yet, over these past few weeks, you now can reach bending just to your knees, lower in your shin. And this is stuff, that I'm documenting. I said, oh yeah, I can. And looking at, we're going over, I had him going from the floor to standing, and it was really difficult for him to do before. I had to put his hands on his thighs. And now I'm like, you can do that without, extra support, which is a really good thing too. And it's only because I'm going back to the goals he and I set together at that first visit, then I can start checking off. All right, even if you're not all the way over here yet, you are in a better place than you were before, and we can objectively look at and measure that.
All right, so setting a overall goal helps you guide the patient and making sure you're including them. And so that was actually one of the good things. I'm glad you came back to that, John, because I was going to say, you just said set your own goal and then make sure you don't take the patient out of the equation, but you give a good balance of how you do that. And so I mentioned before some of the ways that I've asked this question ends up with an awkward what do you mean? So I've asked, what is your goal for today? I've asked, what are you hoping to get out of coming in today? Or what are you wanting to hear after the evaluation? And so maybe what I'm doing there is not actually like goal setting and rehab, but it's just goal setting for the visit. So help me clarify my thoughts there and the process so that I can ask a better question. And I've actually asked the students, hey, when I ask this question, like, how can I do it better? How can I communicate this better with you, right? And so these are kind of the ways that I've done it. What is your goal for today? What are you hoping to get out of coming in today? Or what are you wanting to hear after the evaluation? And the kids that have come in multiple times, they kind of know because I've asked them this question over and over again. And so they kind of have an idea of where it's headed. But the kids that are new, those are the ones that I want to be able to make them feel more in control of their care. So kind of guide me on those questions and how can I make it better?
I think with kids sometimes it's tough because this might be one of the first times where somebody is specifically asking them, like, what do you want to do? There's not necessarily a parent there or somebody else guiding. It's like, it's me and you, and what are we going to work on? And they might not have been in that situation and say, oh, I get to answer for myself and it's about me and what I need to work towards. I love that you were asking all of this. And so I'm with you on that too, that like there's these overall like therapy goals, what they ultimately want to be able to achieve. But then, yeah, there are daily goals. And sometimes like people will tell me, like, I want to learn how to be able to stretch this. Or when I'm in pain, I want to learn how to be able to like take care of it on my own when I'm home. Or I want to learn a different way to do this ADL because right now, it's difficult to do. But all of those little things that, I shouldn't say little, but all those things that they might be a daily goal will still kind of like tie into ultimately getting to like whatever their like larger or bigger goals are.
For me, it's the relationship building. As an athletic trainer, we hang our hat on relationship building and working with our patients and our athletes. You can easily walk into a room and ask the person straight ahead, what is your goal for today? And you may get 40% of the people answer that correctly or do well with that. But there's times where you need to kind of fish it out. And you see it a lot with the younger kids, right? They don't know how to answer for themselves. They may not even know what the word goal means, right? So how do you elaborate on that? My 4-year-old now is amazing at asking these questions that he'll ask a definition of things that we've just taken as part of our daily life, and you have to go back to it and be simple with our patients too. It's not saying that our patients are simple. You just want to be able to elaborate on things very easily so that they understand those things and that you can get around to the point of what you're trying to get at. What's the real question at? Yeah, you want to say, what's your goal for today? What's your goal for this session? What's your goal for rehab overall? But you may not be able to say that because it may turn people off to what you're trying to ask them. So it's the relationship building. It's getting to know the person a little bit, asking about the injury, asking about how many times they've been injured. Realistically, you're talking about the history. When you see a patient in the clinic, your first thing you do is take a history. It's the same thing we do in the athletic training room. We take a history, but a lot of times it's, hey, how was school today? How was your weekend? What did you learn today? My favorite question I ask students, and it always stumps them, is what did you learn today? Give me 3 things you learned today. And then they have to stumble along, and that, throughout that funny question is you start talking about the injury, or you start talking about the game on Friday night. You get those history things, and then you start piecing together things that they say, and then you're able to bring it back to say, hey, you mentioned this. Is this something that you want to change? Is this something that you want to get better at? If you're talking about an injury that happened on a Friday night, and then they tell you on Saturday and Sunday things start getting better, but X, Y, and Z are happening. That's where you take those little bits of information, you hold those in the other hand, and then you start building that to say, is this your goal? Is this what you want to get better at? And then as a department, as a clinician, you use those things to help them achieve those goals.
Yeah, I 100% agree with both of you, John and Daria. I really and truly think it's peeling back an onion in regards to just formulating relationships and developing relationships. So I'll give you a little bit of a personal experience I had just yesterday. I had a new patient come in, and the very first question I usually ask with new patients is, "How can I help you today?" And it's just as simple. It's just that simple. And then they'll say, "Hey, my XYZ, my shoulder, my ankle, my knee hurts." And then again, as John had mentioned, you get a little bit of a history of the injury, and then you kind of start asking some general human questions. How was your Thanksgiving? How was school today? Did you have a lot of homework over the break? Et cetera, et cetera. And then you start figuring out who they are as a human. And a lot of times, just general casual conversation will lead to some goals, maybe not physical goals, but more psychosocial goals that can really limit their physical capabilities. So as John and Daria had alluded to, I think it's really and truly establishing and building relationships with every patient that comes in, and peeling back the onion a little bit as you move forward.
Psychosocial is such a great part too. And I think it's so easy for us to forget because we're focused on more the biological stuff. But like, for example, with building relationships with people, when you get to talking with them, and when you see, because not everybody, many people I see have had kind of more longstanding things, and they start to alter their lives to adapt to the pain or impairment or whatever, and don't even realize it. And then you could ask about, like, say they have grandkids or kids, and that you find out they don't go on the floor to play with them anymore because they can't. Like, oh, I didn't even realize I stopped getting on the floor with my kids or grandkids or pet or whatever. And then like, oh, so what's stopping you from doing that? And sometimes you can find out, sometimes they literally could just be fear. They're nervous. They don't want to exacerbate something. Or they say, no, I literally can't. I can't. Or if I get to the floor, I can't get back up. And now just from having like a little conversation about whatever's going on in their life, you're finding more out. It's like in my case, not all the time, but a lot of the time patients are referred from physicians, and I'll get, my doctor sent me here. They know they're hurt, maybe that is surgery, and they might not have given any thought to it because it's just, you're supposed to go to physical therapy when you're done. That's what you do. Like, okay, well, what can we work on? What is important? What matters? And as everyone said, really seeing the entire person as a whole. Like right now I've mentioned in the previous podcast, I'm in an industrial setting in the mornings, and here, we're looking at, can they work? Is it safe? But again, there are people who do things when they're not at their job. So making sure that you're looking at it the whole, and getting in those little conversations that sometimes I think it's easy to say, all right, I only have this much time. But when you start talking to them outside of specifically the injury or illness that they're seeing you for, you can find all kinds of information to help them.
Daria, I'm glad you touched your earphone because I had turned my microphone off because they play music during the bells, like during the transition. And so they were playing Jingle Bell Rock or something. And I was trying to keep it out of the microphone, but then I forgot. All right. So one of the things that I just picked up, Ray's question was great. How can I help you today? Because I don't think there's any way to confuse that, right? And then they'll be able to talk there. But I'm thinking that what y'all were saying is maybe start talking to them, and then like after you've had several conversations, like, how are you doing today? How can I help you today? But then maybe towards the end, you can ask, okay, what is your goal? Because then they're already kind of on the thread or the vein of, I want to get better, and they've kind of already discussed, I want to be able to sleep at night, or they would discuss, I just want to get back out there and play, or I just want to know it's not broken. What are your thoughts there? Do you think that adding the what is your goal question further down in the history would make a difference for me?
I don't think so. I think it's how you get to that question. And like I said, I don't think you necessarily have to say it exactly like that. But it depends on your rapport with the athlete. If it's somebody you've worked with over the past 4 years, and you're able to be blunt and honest, or quick, and have a quick conversation with, yeah, it's, hey, what's your goal today? As soon as they walk in, hey, what's your goal today? All right, let's get after it. And then if it's a new kid, or if it's somebody you haven't dealt with in the past, or maybe it is a shy athlete that you have dealt with in the past, it's kind of coaxing it out of them, having the conversation, finding those bits of information, and then getting around to asking that question. Maybe you get them on the bike and get them moving a little bit, and you have the little conversation while they're going at it. And then you say, okay, well, what is your goal? Let's set a goal for today. Let's set an objective number that we can reach today, and that way we can feel good about ourselves. We don't have to do 10 extra pounds a day. Maybe it's just 1 extra pound. Maybe it's 10 extra feet versus 100 extra feet. Something to make us feel a little bit better. That way we can compare yesterday to today. And if you aren't able to do that, you're not going to be able to see the progress. In the secondary setting, you usually don't use a lot of objective goals because there's not a lot of reporting back, right? I'm not sending back reports to insurance, which is, great, but, sometimes it's not great. But, I don't have to prove those things to companies to get paid, or anything. But, sometimes you take a look at those things, you show them to the student, say, hey, last week you were only able to do 3 times 10 for 100 pounds. And this week you're at 3 times 12 for 100 pounds. That may not seem a lot, but you know what? Hey, listen, you're doing 6 extra over the course of this exercise. And once you're able to show those things and give proof, that's the reason why you ask that question. That's why you continuously ask those types of questions.
So just on that same idea there, we have an ACL patient, and one of the things that she's been working on is making a full revolution on the bike. So she was going, about a half and then back, half and back. So just kind of rocking. And then she was getting a little closer. And then she's able to make a full rotation. And then she's able to continually make full rotations. And daily, I was like, hey, you're doing, that's better than yesterday. Hey, that's better than, last week. Oh, you're able to make a full rotation now. So using that motivation is good, and it's something that I've done, whether because of all these podcasts or whatever, but definitely something that I've been able to use. And I didn't measure it like, oh, well, you're able to go this many degrees, but it's something that she obviously knows how far she can go, and she's noticed. So I think it's cool. So what are you guys on the previous question where I said working it in there?
You made a good point with the with insurance and setting goals, because anyone who works in outpatient, like, documentation is the worst thing ever. And on one end, we say it's so frustrating to have to do all these notes, but on the other side, like, it like forces me to have to put all these pieces together and look at what we found subjectively and objectively, and what we need to do to get from like A to B. And it really changed like how I look at things, because so it's interesting to me to like see my own personal professional, I say, progress while I was working as an AT, while learning about goal setting in PT school. And it sort of changed it, because I started asking questions I previously wouldn't have. Like, I worked at NYU, and when we would have athletes on crutches, they're in New York City. So I'd ask about, are there stairs to get to your apartment? And they would all just kind of look at me like, or is there an elevator? And like, that's a fair question, because I just started learning about this in school. Hadn't thought about it before when I was an undergrad, when I was a student. And hey, maybe that's something we need to work on. It might not be necessary to play basketball again specifically, but you do need to be able, to get up and down the stairs if that's in your building. So it's really changed the way that I've kind of looked at goals, and even just overall how I do my assessment. Like, to your previous question, I don't necessarily have a time like I'm going to ask about goals like during the initial appointment when we're getting the subjective information. It really depends on the person. But it's just, I feel like I always have like these things thinking in my head as they're telling me little pieces of information, how we're kind of tying it together, getting like a whole picture of the person, and then say, hey, okay, so it sounds like you're telling me this, and this. What are some ways that we can come up with together to help you get to whatever that ultimate goal is?
Yeah, I'll kind of add on that a little bit. So I think, so just going back to your question a little bit, Jeremy, here, I think for me personally, after I said I used the question, how may I help you today? Or how can I help you today? I immediately turned it from there to a collective question. So how can we get you to be confident to return to X? So, how can we together get you in this session to return confidently to swim, to basketball, to football, etc. And that leads to a little bit more conversations. Then that can lead to a little bit more specific goal setting. So again, I'm going to mention my case from yesterday. I had a swimmer come in complaining of shoulder pain. And he said he had pain with abduction, pain with a little bit of forward flexion. And I went into talked a little bit about dynamic posture. We talked a little bit about mobility. And then we talked about some strengthening stuff that you can do. So and what it did is it turned into essentially a home exercise program for him. And then me, so I tailored that for him. We tailored that together based on his limitations. And then I said, okay, well, this is something that we can start off, before practice every single day or 3 times a week, whatever helps you and aids you in feeling, again, your personal confidence in being able to complete what you need to complete on a daily basis. So again, I like going from, again, how can I help you, to how can we collectively as a unit create a better environment for you.
So with the ankle sprain that I've kind of mentioned a couple times, typically with an ankle sprain, I try to give them a timeline, but a functional timeline. So we've talked about functional return to play rather than a date specific return to play from surgery, that kind of thing. And so normally, like, I'll hold out my hand and I'll show them, look, first you need to be able to walk pain free, and then you can move up the ladder once you can jog pain free, and then once you can run pain free, once you can practice pain free, and then return to play pain free. And so normally I'll say, look, this is kind of what we need to see, however long that takes you. And so then they have an idea, okay, well, I need to be able to do this, and this. And so I think that kind of works into how we're talking about like the short-term goals, long-term goals. But let's move into that. So we've kind of got the question, how can I help you today? All right, how can we work together to get better there? Again, building the relationship, asking those other questions, figuring out what's going on in their life, whether that's they want to crawl around on the floor or go for a run, be able to pick up their kids, or get back to sport. So let's talk a little bit more about setting those long-term and short-term goals, because in the secondary setting, I might see a kid in the morning and during the athletic period and after school. So do I have to set 3 different goals for them that day? Do we just say, okay, well, this is our goal for the week? So what does that look like in a high school type setting, rather than somebody that may only come in a week to, say, a physical therapy clinic where, Daria is seeing them once a week, once every 2 weeks, or whatever it is. I don't know the exact situation, but.
So I'll start off. For me, it's, and anybody who sat in a committee meeting with me, they know, or they're probably annoyed with my talk of the target. All right. What does your target look like? And the target is, realistically, for me, it's the goal. All right. So in the middle of your target, you have your bullseye. That is your number one goal. That's what you're working towards. So if it's back to the playing field, playing 100% pain free, that's your bullseye. We know that targets have rings. Ray, you talked about the onion. We peel back the onion, right? What are the layers to that goal? So if you look at the target, if you look at the onion, you notice there's different layers to it. You start setting those goals to reach that bullseye. So the bullseye is, what do you want to accomplish at the end of this, so that we, never have to see each other again, because that's the goal of athletics. You want to know the athletic trainer, but you don't really want to get to know them. What's the center? What's the outer ring? So what's the goal to get to that center? What's the goal out here to get to that ring, to get to the center, and then so on and so forth. That's how I look at it when it comes to goal setting. We set those goals from the outside in, but knowing that our center, our bullseye, is what we want to achieve overall. So yeah, you may see the athlete 3 times a day. You may see them 3 times a week. It doesn't change the fact that what you want to accomplish with them is what they're setting forward. All right.
Yeah, I'm very similar with that in my setting. So I literally have to just sit and write out goals. And I always start with the long-term goals, and it could be 4 weeks, 6 weeks, 8 weeks, depending on why they're seeing me. I'm all right, here's the big ultimate thing. And then, in part because this is just the way our system works, but I like this. And then, okay, so say it's an 8-week goal. Let's go back. What do we need to achieve at 6 weeks approximately, or 4 weeks and whatever, same thing, versus a target. And I have that same idea of just kind of working out from there for me. And that's not necessarily right or wrong. Just for me, that's kind of what's always worked, to see that big ultimate thing first, and then kind of inch our way back. From a patient standpoint, sometimes when you're speaking with them, you might have to go the opposite, that they might not even be able to or want to think about that long-term goal because it's so far away and they're so frustrated that they're not at a point where they want to be. So first, it could just be something really simple, like I want to be able to walk this far. I want to be able to drive again if they have an injury or surgery to their right leg. before we get into those bigger athletic goals.
Yeah, I love both of those ideas. So I think I'm going to speak a little bit to what John had alluded to before. So before, when he was talking about the overall department goals, and kind of just setting them on a board and always looking back to those. And then in addition, the target with the bullseye he just mentioned. So I think having our patients just see what their goal is important. And visualization is such a huge part of rehab sometimes, just because if a patient can't see it, they're going to have a very good difficult time getting to where they want to get to at times. So there's times where I'll say, hey, take a picture of your ankle. We'll talk about your ankle, Jeremy. So take a picture of your ankle today, and let's take a picture of it 2 days status post the injury, and let's see what it looks like. Let's see how you've improved. And then kind of go from there. Or let's take a video of you walking today. Let's take a video of you jogging today, and obviously ask for their permission to do so. But and help them see the progress. But I think even if you write it on your whiteboard while you're in an athletic training room, like, hey, Daria, today you mentioned this before. You took 5 steps today without pain. And then we get to the next day. Today's 10 steps without pain. Look how far you came today. Again, they can. It's more. They can visualize it and see their progress.
All right, so if you're listening to the live stream, you'll see there's pauses. It's because I'm taking down these notes so I can remember, so I'm not just hearing it, and because really this is a problem, not a problem, but an issue I want to get better at. So I try to take down the notes from people who are doing things well. And again, I like the idea of taking the picture, but it's so cool because you can have the students, because they pretty much always have their phones, you can have the students, hey, you take the picture, you keep it, and then maybe, you make it a TikTok or a Snapchat story or whatever it is, and you put all those pictures combined and you see the evolution of your ankle. Or you say, okay, well, set up your phone, video yourself walking, and do it from the different angle, because they're used to putting themselves on video or camera all the time. And so then it's incorporating something that they already like, helping them see their goal. But John, you said the bullseye. Ray, you said I like them to see their goal. And Daria, you said you sit down and you'll write it out. Do you have like scratch paper in your office and say, okay, well, write down on the center of this bullseye what your goal is, and then we're going to work together? Or is this something that you just talk about, or is it something that you do on your own time and then hand it to them?
For me, we keep SOAP note and rehab sheets out for all of our athletes. So athlete comes in, say we start seeing them. Typically for me, it's around 3 times. So student comes in, they get their ankle taped, or, hey, maybe they rolled their ankle and they're good in a day or so. We're not doing a lot of stuff with them. We don't do a lot of writing down with them. It's the students that we start seeing daily. Maybe they're coming back from surgery, or maybe they're dealing with a chronic injury. That's when we start writing down our rehab notes. We keep on one side of the sheet, we keep a log of the exercises, and then we chart it out. So we chart, on one side is the exercises, and then we chart it out daily. We go back to that. We talk with the athlete. We get to show them the progress that they're making. But on the other side of that is the old school SOAP note. A lot of times we don't write on there, but we'll write on the end of it the plan. And we'll always talk with our students about the plan. What do we want to get out of our rehab? What are we trying to accomplish here? That's the what is our goal? And we write that down. And if I don't do it every single time, at least we go back to that. That is the number one thing that we're trying to get at. And if we write it down, we're not forgetting it. So we can say, hey, our goal for today is this. And then you may ask me tomorrow, and I've already forgotten it because I didn't write it down. Once you write things down, they become more of a solid thing that you go back to. It becomes more of that bullseye for me. We start working, and maybe we start pushing a little bit too much. Maybe we get a little bit into the weeds and the rehab exercises. We start doing some crazy TRX stuff. Are we achieving the goal that we set at the beginning of this, or do we need to change the goal? So that's why we write it down. We always write things down so that we know that is the center of the bullseye that we want to achieve.
Yes, agreed. Yeah, I in a different setting, I write down everything. When I first have my first session with a patient, I just have a Word document open because for me it doesn't work to type into our system right away. So I just have this big Word document writing stuff, and I go back later on, and then they'll put it together into like a nice readable paragraph or two, and then I'm still then. By nature of being an outpatient clinic, I have to then go through the objective and get all my measures and all those things in, and then move into the assessment, which that's where the specific I have to write out what all the goals are. And I'll literally be in that page and like, nope, I have to go back. Let me look at what they were talking about subjectively. Let me look at some of the things that I found in the in the objective part to then go into the assessment and like writing the goals. So for me, like I'm typically not like sitting with a patient, like writing them down, like literally with them. But sometimes what I'll do, especially when it's longer, when they're like post-ops or people just have very long-standing chronic conditions and they're getting frustrated, I'll literally show them. I'll open up the program and say like, hey, look, like 3 weeks ago on this day, whatever it was, we did this. And I have it written down so we remember. And now, today, look, we're doing this and this exercise is harder, however we want to measure that, to help show them that they are making progress. And it's for most people it's helpful because it's easy to like lose as a patient, I think, to lose sight of things, especially if it's a longer rehab and they've been there for a while and they feel like they just see you every single day, or maybe they do, to be able to show them, to look back and give them some numbers and things. And for some people it might be the specific goal. Some people I might just pull up, look, this was your degrees of range of motion at your ankle that you had before we measured it, remember the day we measured it, and now we're over here. For some people, might be more helpful to look at the functional things, like they don't care about degrees. That means nothing to them. It could be before you had to go up the step one at a time, and now you're able to go up the steps reciprocally. So that's where, again, like super helpful, because also I would not remember anything if I didn't write it down. So it's very helpful to me to have it. And on a day-to-day basis, as the patient's coming in and I'm talking to them, again, I'll just quickly write down in a Word document what they're telling me, and then go back later into my note and incorporate that into what we're doing that day.
Yeah, I think what I like to do is, so every single day I write our, we're by appointment here with COVID, which is really nice. But every day I'll have every single student athlete that's scheduled an appointment with me for the day up on the board and their specific treatment and rehab plan for the day. The good part about that is that even during our session or at the end of our session, I'll go through and I'll say, okay, well, what did you like? What didn't you like? What was easy? What was hard? What can we improve, et cetera. So they have a little bit of visualization there. The second thing that I like to do is there's times where I'll pull up, Daria's profile on our EHR, and I'll actually, I'll put a plan together at the end of my documentation, and I'll sit with the athlete and say, okay, let's write it. Let's type it out together. What's our plan for tomorrow? Or what's our plan for our next session? How did we feel today, et cetera. And then you get a little bit more of, again, that feeling of communal effort and collective effort.
One of the things that recently I've tried is I said, okay, it's kids that may have been coming in for a while. I said, okay, so what we need to do is we need to warm up. We need to do these exercises. Then we'll do some new exercises, and then we'll foam roll at the end. So how do you want to warm up? And how long do you feel like you need to warm up? And so, again, it's talking about giving them ownership. Like, all right, well, I'm going to go walk up and down the stairs, or I'm going to hop on the bike. I'm going to just go jog 5 laps around the gym. Okay, well, when you're done warming up, you come back, and then we'll get started with these exercises. And, again, it's helping them listen to their body. So that's one of the things that I've done. And we use Rank 1 here. And so what they have a public login. So essentially the computer, the kids will just log in. They'll give them their ID, their sport, the side, or left, right, whatever, the part of the body and the side of the body, so that when we go back later, we'll be able to add some documentation. And so then a lot of times I'll take a paper and then just write down, Ray, he's feeling okay. Pain is 2 out of 10 today. All right, well, that's about the same as yesterday, or hey, that's less than yesterday, just because I remember or they remember. And then I ask them how full is your battery question, and then what I've been trying to do is write down right there on that paper, okay, well, here's kind of what I would like to do today. How do you feel about those exercises? Are those challenging enough? You want to add in some more right there? And so then, like on that paper, similar to what you're doing on a board, but, kind of as we're talking about it with them there, saying, okay, this, and this, does this meet your goal? Yes, we're going to try and we'll do these exercises. I know you have to leave at 4:30, so get as much of these done as you can. You know how to warm up, however you want to choose today. And then if you're having any problems, then, let me know and we'll adjust it from there. So lots of good stuff. I like the making sure you write it down, the target, just changing the way you ask, getting to know them better, and not be like, what's your goal when you walk in? Because like John said, 6 out of 10 or more are not going to know what you mean. Like, what do you mean? Coach just told me to come in. That was my goal, to follow what coach said to do. Okay. All right. So how can I help you today? All right. Tell me a little bit about what's going on. And all right. So what would you like to see? What would you like the outcome to be? Or, what is your bullseye? So I think those are definitely good ways to kind of change it up and ask. And, I've talked about it before here in Pasadena. We're largely Hispanic. Some of them are first generation American, or, some of them are only citizens because they're born here, that kind of thing. There's some of them are even just undocumented. So they're not used to somebody talking to them about healthcare or even, having healthcare. And it's one of those barriers that I have to try to put myself in their situation. And the best way I can do that is by asking them, hey, how can I better communicate this to you? Or if, maybe somebody who's not as shy, but a kid that's been in the athletic training facility for a while, and they can say, hey, you can ask this question better by doing this, that kind of thing. See. All right. Let me look at the other questions. It says, are we setting goals only for time loss patients? And I think we've answered that. It's pretty much, it should be for everybody that's coming in. Maybe not that kid that, hey, I just want to get my finger taped. Okay, well, that's your goal. You're going to tape your finger because they jammed it. Give you maybe a quick tip. Hey, why don't you keep it moving when you're outside of practice? Cool. Right, so we're not going to sit out and write down all the goals for that kid. But for any kid that is going to be in there for any length of time, you definitely want to do this. So speaking of which, Daria, on our last podcast where we talked, the industrial IT or the data collection one, we've actually added that to our EMR, and we've been marking it for anybody who misses a day. Again, like I said, there's the hole in the data where if they don't come in, like over Thanksgiving, if they didn't sign in for treatment, we don't have that, but it's still better than what we had before. So it's something pretty cool. It'll just help show information later. So what other tips for implementing patient goal setting in rehab do you guys have before we bounce?
I have something. I just thought of this because everything we've talked about so far is, it's like pretty examples, straightforward orthopedic things. Kids are probably going to be better soon. But somebody specifically I'm working with right now in this industrial setting has some long-standing pain. It's really complex. Is able to do stuff like can go to the gym and work and all that stuff. And for him, the goal isn't like to be pain-free because it's for multiple reasons probably not going to happen. And he's very focused on symptoms. This is a very big thing, very, very, very hypervigilant of symptoms. So in that case, my goal with him isn't necessarily setting up like a specific rehab program and things, but we're trying to work on literally finding something to have fun with in his life that takes his mind away from all these symptoms that he's feeling, that might sound silly to people, but I literally asked him, like, is there a point where you're not feeling this pain? And he identified something like, hey, that's a thing. That's awesome. Even if it's just a few minutes, you have a thing that we can talk about when you're not feeling these symptoms. All right, what else can we work with? And then, going into like hobbies and activities and like socializing, whatever, because working with people who have like some longstanding things, it kind of changes. And like I said, maybe being pain-free isn't going to happen, or maybe having 100% full function, whatever that is, for whatever reason, isn't going to happen. I work with people who might have Parkinson's or MS or other neurodegenerative things. So we're kind of trying to, again, as we said before, and kind of look at the whole thing. But specifically, I found with people with like persistent or chronic pain, which is unlikely, but you could see that in a secondary setting, is that with the child population, you might have to change your focus and change your plan and say, we're not doing exercise today. Maybe we need to learn a relaxation technique. Maybe we need to help identify something that you could do at home that is helping to change your situation. So that's something that also changed with me as I started working more as a PT, because I was used to seeing young, healthy athletes who they have an orthopedic thing, they're going to go through this process and they're probably going to be fine in a few weeks or months. But always being open-minded with that too, because I found with me sometimes I don't always see that at first. I'm still thinking like, all right, we got to do some exercises to get you better. But sometimes it's not, and sometimes it's helping them to find strategies that they can take away to do things on their own.
Yeah, I think my big takeaway from this podcast today was that there's not necessarily a right way to go about goal setting, right? So, myself, John, Daria, and Jeremy, we all use our own ways, and for better or for worse. Sometimes they work, sometimes they don't, and you learn from it. So I think the beauty of this podcast is just, again, learning different ideas and tips to move forward with your particular patients, and then secondarily that. It's really all about the patient. That's what matters the most. Is just going back to how they feel, what they're observing within themselves, what they're observing in the clinic in terms of what they're receiving from the clinician, and then creating new habits moving forward to promote growth in terms of their physical capabilities, emotional capabilities, social capabilities, etc.
For me, it's practice what we preach. I think a lot of athletic trainers are great at what is it? Do as I say, not as I do. I think this is a case where we need to practice what we're preaching. So what are you as the practitioner? What are you as the athletic trainer doing? What goals are you setting that are going to help your patient population? How can the goals that you set on a daily basis, on a monthly basis, on a seasonal basis, whatever it may be, how are those goals helping you help your athlete or your patient achieve their goals? So I think if the athletic trainers are good at setting their own goals, they're going to be able to better assist their patients and their patient population attain their goals that they want to set.
Just over Thanksgiving, I during the whole month of November, I ran 2 miles, and so just over Thanksgiving, my left arch was really hurting. I was like, okay, what do I do? So I try to do those things, implement the things that I know. I use John, you okay? Yeah, okay. You look really excited, really, and I'm telling a fascinating story or something. Okay, so my
I can't just be proud of you for running every day. I was really excited about that. Okay. Sorry.
So I was just making sure that something crazy wasn't going on. All right. So my left arch was hurting. So I was like, all right, so let me try the lacrosse ball. Let me try the Theragun thing. Okay, well, let me try the ISTM. I was like, oh, okay, that really helped. Well, let me continue to do it, not just today, but let me do it for several days and then do some of the other things as well, because my goal is to get rid of that pain so I can finish my month-long run. So, again, like you said, practice what you preach, do those things, implement those healthy habits into your life, or like Daria, like you tell your patients, sleep, right? So those things that you're doing, set those goals, practice what you preach, write things down. And I think every single comment, suggestion is centered around the patient. So don't put your ego in the way, step out of the way, focus it on them, give them ownership, allow them to be in charge or responsible of their own health care, and you're going to walk with them and guide them. So if you're pulling them, leading them, then you're not doing it correctly. I think that's a really good overall, but then there's lots of good practical tips within this podcast. A lot of things that I'm going to be able to take away and do. So I know if you go to physicaltherapy.com/one-free-course, that's the number 1 and then FREECOURSE. So physicaltherapy.com/one-free-course. It's about $100. You can get unlimited CEUs. And, I was just looking it up. They have some goal setting for patient care, and they have some that are like home health care. But, if you go through those courses, then you pick up 1 or 2 tips, implement them, pick up 1 or 2 tips, implement them, those kind of things. Then that's really how you're going to grow, other than just completely changing everything. So, again, check out physicaltherapy.com/one, so the number 1 free course, and go from there. John Ciecko on Twitter. So John, Cicko, best way to get a hold of John. Daria, last time said On Tap Physio on Twitter. Great way to get a hold of her. So On Tap Physio. So there's 2 P's. So TAP and then PHISIO. Ray Olivo 20 on Twitter. Ray Olivo 20. And again, I'm Mr. Jeremy Jackson on most social medias. So if you find me, you can probably find the other ones because I've tagged them in this post on Facebook and Twitter and Instagram and things like that. So if you want to get a hold of one of them and you can't find them on social media, then just reach out to me and I'll hook you up. Daniel Young was going to join us, and there's a link in the show notes that I'll put in the post that he uses for goal setting. He said he uses it like in his classroom and his student athletic trainers, and then it can easily be adapted for athletes if you wanted to have like a little worksheet, like, okay, what are your goals for today? How are you doing today? That kind of thing. A lot of the same stuff we talked about. So I think that's it. sportsmedicinebroadcast.com/goal setting in rehab. sportsmedicinebroadcast.com/goal setting in rehab. So for Jeremy, Daria, Ray, John, and the Sports Medicine Broadcast, that is a wrap. Thanks.